Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Things were changing very radically in the 60s as far as equipment and anesthesias and types of surgery and so on.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Kathy.
Good afternoon, Chris. What's going on today?
Well, this show today is a little bit different than what we typically do because we are going to be interviewing Dr. Don Shields, who is a legend, a living legend, and a true pioneer in veterinary medicine.
I am always excited to talk to people who paved the way. So I have lots of questions for Dr. Shields for today.
Yes. And I learned, he told me that we could call him Dr. Don, Kathy.
Oh, great.
So
good.
I learned of Dr. Don from his daughter, who actually works where my mom lives, doing activities and things like that in the dog and cat world. We call it enrichment, but it's enrichment for the people. And so Gretchen said, when she learned what I do and that I have a podcast, she said, my dad actually put a pacemaker in a dog in the 1970s. And I'm like, what? So I'm like, we need to get this man on the show. And it's been a few months coming, but here we are today. And I'm super, super excited.
I had the great honor in working with one of the cardiologists at Angel Animal Medical Center, in those days, Angel Memorial, in the mid 80s. And we were doing pacemaker implants at that time with Dr. Neil Harpster, who was a brilliant cardiologist. And I'm really fascinated that Dr. Shields even thought we can do this. So I have so many questions about that. And I feel like now in 2025 versus when I was starting in 1985, the industry has changed so much. You can almost get anything that you can get for yourself. You can just about get for your pet.
Right. And I think that's going to be a big focus of this show is how far the veterinary industry has come, and really due to trailblazers like Dr. Don. It may surprise you to know that he turned 88 last month, just in June of 2025. In fact, he's still in the game, if you will. He's still doing consultations. We had to wait just a moment to get on our Zoom meeting today because he was talking about a pet in need, and that's just fantastic. And he's treated everything in his career, from birds to boa constrictors, but mostly cats and dogs.
Veterinarians are hardy. They live long lives and they treat patients right up until their 80s.
And he's clearly passionate about it, because I know that when we talked prior to our actual interview, that he is often the last man standing. He's the one doing the things that others don't want to do. So we're going to gain some insights into Dr. Don's pragmatism, his work ethic, and certainly his humor. We'll discover just how much veterinary medicine has evolved in the last 6 decades. Ultimately, what we owe those who came before us, like you said, Kathy, and I think first and foremost is extreme respect for those that paved the way.
Yeah, we would not be where we are today without them. So yeah, let's get down to it.
All right. So I would like to welcome the esteemed Dr. Don Shields to Petability.
Welcome, Dr. Don.
Hello, glad to be here.
Let's just start from the beginning in terms of your life story. So what drew you, Dr. Don, to veterinary medicine?
Well, we always had a dog in my house, and we had a little pet named Lucky, and she lived to be 10, and she died when I was about 14. And she was my true buddy. We used to ride bikes together. I mean, I rode the bike and she ran, of course. But I've always been interested in science and biology and medical things.
Mm-hmm.
And so I didn't have any flashing lights or blinding direction. I just knew I wanted to go into medicine. And then as I went to high school and college, I continued as a pre-med in college. I went to Bucknell University. And then it was along the way, I decided I would prefer veterinary medicine to human medicine, possibly because I thought it would be easier to work on animals than to people who, talk and complain all the time. I was wrong because people bring their pets and they still complain and everything. So
that's exactly what I say, Don. You saw the light before I did because
yeah,
I didn't have any flashing lights or anything pointing me in a direction. Similarly, I studied biology, psychology, and pre-med because I thought that's going to open any doors that would possibly be of interest to me. And then kind of by default, I ended up being a physical therapist, but it wasn't till well into my career as a PT with people that I pivoted to work with animals. People say, I bet you like that better. You don't have to deal with people. And I say, well, every pet comes with a person.
that's right.
Yeah.
Well, you did go to UPenn School of Veterinary Medicine and you were part of the class of 1963.
Correct. Yeah.
How many vet schools were there at that time, Dr. Don?
17.
Wow. So that had to be highly competitive.
I got in just before it got terribly competitive. I had pretty good grades, and I guess I did well on the veterinary test that we had to take, basic medicine test for MDs and veterinarians. But it didn't. The field really got crowded in the 70s, so I got in just before that started. After I got in, the next 10 to 20 years, it took many candidates to vet school already had master degrees and PhDs because it was really hard to get into.
It's still competitive. And I'm looking back to thinking about you getting accepted into veterinary school in the early 60s and that it was largely or predominantly a male profession. And now in 2025, I think it's predominantly women.
It is pretty much. I think some veterinary schools, it's 89% women.
I knew, like, even now there's a paucity of vet schools, but there's 33 that are fully accredited in the US at this time and 4 more pending their accreditation. And even with, it really has become a career that many more folks are seeking. It's a challenging career. It needs to be your calling, your passion, because it is not easy. Dr. Don, do you have any particular mentors or pivotal moments that you can share during your training? Or was the next step graduating from school and founding your own veterinary practice?
Well, I had several good professors. We particularly had a very good cardiology staff. I noticed that your partner there worked for the cardiologist, and this was in the 60s when practically none of the veterinary schools had specialties like human medicine has had for a long time. Cardiologists, oncologists, all the different specialties. And Penn was one of the first and we had an excellent cardiology department. So specialties were just beginning in the 60s. The one doctor I had was an orthopedic surgeon, Dr. Jacques Jenny. He was from Switzerland, and he was an excellent orthopod and got me involved in doing quite exotic at the time compression plating for fractures. And he was my mentor on that field. In fact, I rode back from a convention out west as a poor starting veterinarian, and I was riding with Dr. Jenny in the airplane, and I realized I had no money, and he lent me $20.
Aw.
Well, that was very kind. Yeah.
So I could get my car at the airport.
Yeah, it was very nice.
I don't think I ever paid him back, but
Well, you did by, carrying on, your work and so forth. So,
Dr. Don, why don't you tell us a little bit about opening up your own practice in the Philadelphia area in 1964? Can you tell us a little bit about that journey?
I interned at Penn 1 year after I graduated because they were short on surgical professors. So I got to do a lot of surgery at the university before I left, which was helpful to me. And then I had a classmate, a young fellow class ahead of me, and we decided to go and practice together. So I bought a practice in a very tiny practice in Huntington Valley, PA, and we opened up in an old little house and gradually turned it into a hospital. And that was in 1964.
What was the name of your clinic, Dr. Don?
It was named after a small town north of Philly called Bethayers, part of Huntington Valley. And Bethayers is the name of a early founding woman. It's called Bethayers Veterinary Hospital.
that had to be pretty brave to take that on, and start a business, start your own practice as a new grad. And the hospital grew and evolved. Tell us about some of your most memorable cases and, what you did there. I know you did some pretty remarkable things.
First of all, he played a guitar and I played a banjo a little bit. So the first year or two, we had plenty of time to play music. But
Well, you got to have that work-life balance, Dr. Don.
so after that, we started practice together, and we didn't have a lot of equipment at the time. And I had a case of a dog that had a diaphragmatic hernia, which was it's where the diaphragm is broken when you have an accident, hit by a car. And we had to operate, but we didn't have a resuscitating machine. So my partner breathed for the dog for an hour and a half while I repaired the hernia. So,
Oh my gosh.
after that, we started getting more and more equipment, and we just kept growing with the things were changing very radically in the 60s as far as equipment and anesthesias and types of surgery and so on. So it was a great time to be a veterinarian. Now everything is done by specialists.
Oh, I was just curious about, again, some of the most memorable things, and certainly having your partner veterinarian breathe for this. Was it a dog for an hour and a half? Would be memorable.
Of course, I wasn't the fastest surgeon because I was just out of school.
You use what you have, and you do what you need to in an emergency, and what's best for the pet that's in front of you.
And as time went on, we got more and more equipment. One thing that I mentioned was the orthopedic surgery. I went to Davos, Switzerland, where they were teaching this method of compression plating for plating fractures. And I used that very successfully for many years. There were a lot of more road accidents back in those days than there are now. And there were no specialty clinics. The University of Pennsylvania was at the other end of town, but there were no specialty clinics like there are now where you can take your pet. So we did those.
Back in the day, we did everything. The veterinarian did everything. I said earlier, I had come into my career somewhere in the mid 80s, and we didn't have things like MRI machines or CT scanners, or, I think when I left Angel, we had just gotten an ultrasound machine, and that was like, whoa, that was big. That was big time. But we had to figure it out because we didn't have these things available to us. So we had to be critical thinkers.
Good part and the bad part about being advanced. It's advanced beyond the capabilities for the average person to pay for it. That's one of the problems with veterinary medicine right now, is that you can get a diagnosis far beyond what we could get in the 70s and 80s. But then having to pay for the procedures is getting to be a problem. And there is insurance, and it's becoming more and more useful. But now what I do is I do home euthanasias for people. And unfortunately, sometimes the cure is greater than the owner can afford.
It's unfortunate too. You're right. I think that, and I think, if I'm looking at it from the veterinarian perspective, from when I worked in a private practice, I think costs for them have gone up as well. And then
absolutely.
Paying for your veterinary technician staff and then having to pass that on to the client. And no veterinarian wants to do that. They really don't. But it's unfortunate that I think that I hate that we price people out. I hate that.
I wanted to circle back, Dr. Don, to you going to Switzerland. I think when we talked last week, you said that it was actually a conference for human doctors, right? Surgeons for people.
Yeah, this was sponsored by a company called Synthesis, which is a Swiss company that makes orthopedic equipment. They were just coming out with a new type of plating, which is called compression plating, which essentially means when you put the plate on, it pushes the bone together and it heals much quicker. So that's the premise. But anyway, there's a whole gamut of instrumentation and so on. So the conference was in Davos, Switzerland, and it was MDs, about half MDs, half VMDs. They had combined lectures that worked for all species, and then there were individual lessons, veterinarians, and individual lessons for medical students. And in between those, we skied 4 hours a day. So
bonus.
Oh, nice.
And the only problem with the trip was that the skiing wasn't very good. And I had a brand new pair of skis, and it looked like snow, but there was tiny little stones in it. So I ruined. But
unfortunate. Yeah.
that didn't bother me that much. That was worth an excellent experience. Yeah. Yeah.
Dr. Don, I'm really interested, and I've been biting at the bit here to hear more about the pacemaker that you did in 1974. I mean, I'm thinking too, like I haven't done one in a long time, probably since the 1990s, but I mean, you had limited equipment. Did you even have fluoroscopy to watch you guide the wires in? Like, how to go right into it? I'm really want to hear about this.
Well, I had some help. I had a client. Well, the doggy came in. He was 13 years old. He had very bad congestive heart failure, but he also had a slow rate. So the only thing we could do for him was a pacemaker. And I didn't have a pacemaker. And then within a few days, a client of mine who was a cardiologist, human cardiologist, came in, and I'm telling him about this dog, and the dog needed a pacemaker. He says, well, I can get you a pacemaker. So he got a used human pacemaker. It was not a lithium battery. It was a cadmium battery. So it was pretty big, bigger than a pack of cigarettes. And he said, I'll get you a pacemaker. So he gets me a pacemaker and the leads and sterilized it. We don't know how much time it had on it because it was a very rudimentary pacemaker. And he came in and he did it. We anesthetized the doggy. He put the lead down the jugular vein, and you can tell we're in the right place because it picks up the beat. And then you put the pacemaker under the dog's skin and his neck. And the poor thing, he was only about a 25-pound dog, and the pacemaker was half as big as he was. But he had loose skin, and so it fit in. Well, he had severe heart disease, so he lasted about another 8 months, and he lasted before the pacemaker ran out of electricity. So that worked out.
I didn't start doing them with Dr. Harpster until like 86 or so. And I think of it now, and you're right, it was like the size of a pack of cigarettes. And the last time I did one with another cardiologist, it was this little, like a little disc. It would just fit just under the subcutaneous tissue. And it was so small compared to what we were working with in the 80s. But that's what we had.
Well, the one in the 80s was far superior to the one in the 70s. So I get the second one, comes in about 10 years later, in the early mid 80s. Not sure exactly what year it was. And so I called my cardiologist friend who was still there, but he was getting ready to retire. He was older. He says, I said, can you get me another pacemaker? He got a salesman to give me a brand new lithium powered pacemaker.
Nice.
Woohoo.
Nice.
Which was about half the size of the other one.
Mm-hmm.
And the way this one I put in was go into the incision in the abdomen. You screwed the pacemaker into the base of the heart through the diaphragm.
Oh my gosh.
And
Wow.
the pacemaker stayed in the abdomen. Sewed him up, and that was that.
Wow.
And that dog was only 8 or 9 years old, and his heart was healthy. He just had electrical problems. So his rate wouldn't go up. So he couldn't exercise because his rate wouldn't go above 50. He lived for about 5 or 6 years with that pacemaker.
There's nothing quite as stressful in my mind as a technician as monitoring a patient that's getting a pacemaker until that pacemaker goes in. And I've had a patient whose heart rate was 30, and I was sweating it out. Yeah. And then as soon as that pacemaker kicked in, whatever he set it to, I think it was 90, boom, it was 90, and that was it. It stayed. It was so remarkable, but gosh, it was stressful.
Well, when you think about it, when the dog's anesthetized, there's less stress in the heart than there is when he's active and moving around. So,
and I have more control because I've got you intubated and I can access veins and stuff, but boy, still sweating it out. Just mentioning to a client in the 80s, and I'm sure Dr. Don had this experience, we're going to put in a pacemaker. The owners are like, what?
Yeah.
But now it's fairly common practice, and they do so well with it. Is it true that people can donate their pacemakers for pets? Is that true?
It's actually a group that collects them. Yep.
No kidding.
Yep.
Chris, we'll see if we can get that so we can get it on our show notes.
Wow.
Yeah, there is an outfit, and I don't know the name of it.
Do you think, Dr. Don, you could tell us a little bit, I'm really interested in this too, about co-authoring a paper in Scientific America on myasthenia gravis? I've been a technician for probably close to 40 years now. I've only ever seen 3, maybe 4 cases. Can you tell us a little bit about that?
Well, that's interesting. I got my name on the paper, and I did practically none of the work. But
that's the way to do it.
That's the way to do it. Yeah.
The neurologist at the 60s, we had specialists in our practice in the veterinary hospital. We had a neurologist, ophthalmologist, cardiac team, etc. And so the neurologist, my classmate and I had this case. This doggy who couldn't walk, kept falling down, and I had not a clue. And my good friend Joan O'Brien, who has passed several years ago, she was quite bright, and she said, "See, we ought to think about myasthenia gravis." So that got us on the track. And then the neurologist got involved, and he had a colleague who was an microscopic person who worked at the University of Pennsylvania in the medical field. He was an MD. And so we took tissue from this doggy and sent it to this electron microscopist, and he published a paper. And because Dr. Steinberg and myself had the case, our names were on the paper. But the paper was positively identifying myasthenia gravis in the dog. And it's in Scientific America.
Could you let the audience know what is myasthenia gravis?
It's a neuromuscular disease. And so the more you exercise, the weaker you get. That's the bottom line. And there's a drug you can give them to make the diagnosis. You may get them real weak, and then you give them this drug, and immediately puts the acetylcholine back in. That's the name of the drugs that are working into your nerves, and the animal immediately gets better. So the treatment is you give certain medicines that counteract the thing that's gone wrong.
Right.
Dr. Don, I'd like to just do some follow-up questions there. So was your discovery of myasthenia gravis the first to prove that this disease exists in dogs?
There have been reported cases that responded to the treatment and were suspected, who appeared to be myasthenia gravis. Yeah, I think it was the first one. That's why it made Scientific. That was a human Scientific American article. It wasn't a veterinary article. It was in the.
Yeah. we knew about it in people, but we just didn't know that. Okay. And I remember when I was working in the Boston area at a large specialty 24-hour emergency hospital. So I happened to be walking by and I heard this raucous uproar about this dog, that was walking. And I'm like, what is going on? And they said, we just proved that this dog has myasthenia gravis, because they had done just what you said, Dr. Don, where they gave him the injection and then he was up and moving and walking across the floor in the veterinary hospital. And the neurology team was the one that was supervising that. So I had never heard of the disease, I don't think, before. And that was really eye-opening for me.
Interesting. It was a young dog. He was less than a year old, little terrier. The people lived on the other end of town. So I dealt so much times with this lady. She lived at the south end of Philly. I lived up in the north. Where I left the practice. She found me and came to my hospital for several years later. And he actually got over it. And in humans, it's an autoimmune disease. I guess it is in dogs too. But this dog actually, he outgrew it. He took the medicine for a few years. And the odd thing is, if you don't have the disease and you take the medicine, it gives the same symptoms as the disease.
Oh,
It's
interesting.
a very complicated process. But it all has to do with the chemicals at the end plate with the nerve. It's the muscle. There's a whole bunch of chemical reactions, which if they're screwed up, don't work.
Yeah.
So if they're not screwed up and you give them this medicine, it screws them up.
Yep. I can imagine.
So all of a sudden, Rusty, his name was Rusty. I still remember his name, and I'm talking 60 years, 50 years.
Wow.
He made an impression.
His owners. The owner was this little old woman who took taxi cab all the way from South Philadelphia up to my practice for me to give him his vaccinations. But all of a sudden, she called me. He says, I'm just still giving the medicine, but he's starting to limp. He's starting to get weak again. We stopped the medication. He never needed it again. He took it for about 3 or 4 years.
Amazing.
But in humans, it's mostly in older people. I had a friend of mine who was an MD who got myasthenia gravis when he was in his 60s. So it's very strange. Autoimmune diseases are very unusual.
They really are very unusual. A patient who was brought into the clinic 24 hours after receiving 7, maybe 8 vaccines the day before all at once. And I'm not sure if this was the trigger for this condition, but he came in looking like he had contracted hamstrings. Like he was in a position where he looked like he was just trying to, have a bowel movement and he couldn't get out of it. And it quickly went down from there. And so I wonder if there's what the trigger is, now we wouldn't give 7 or 8 vaccines all at once, but I wonder if there's if there's an underlying trigger here with or multiple vaccines all at the same time. But again, that's only one patient. I've only ever seen like 4 myasthenia gravis patients in my whole life. So
yeah, give vaccines to millions of dogs, and every so often one will have an allergic reaction to the vaccine. And
so, Kathy, this dog that was walking, in a squatted position, it was myasthenia gravis, though?
Dog did have myasthenia gravis, and it was sent over by another veterinary practice, and the veterinarian that we worked for at the time, Chris, you and I both worked for, is not only specializes in rehab, but she's a radiologist, and she's seen cases of myasthenia gravis, and she called it right off the bat. She's like, that looks like myasthenia.
Yeah.
And sure enough, we sent him to the neurologist that afternoon, thank goodness, and he started treatment. But yeah, it was scary to see.
Over 50, 60 years, and I think I saw 3 cases of myasthenia.
I've seen maybe three that I can think of, maybe 4.
Yeah. Yeah, and you're in a clinic that covered a lot of
Right.
area because there's a referral clinic. Yeah.
Right.
Dr. Don, pivoting here a little bit, I'm just curious why you told me when we talked last week that you feel fortunate the time that you practiced the golden era of veterinary medicine. Why do you say that? What made it golden?
Because prior to the 60s, veterinary medicine was very rudimentary, way behind human medicine and what you could do. The people 10, 20 years before me that I knew, they couldn't do half the stuff I did when I graduated in the 60s. They didn't have the knowledge or the background. During the 60s and 70s, veterinary medicine was advancing rapidly in what you could do and what we knew about it and so on. And there weren't other emergency clinics around, so the veterinarian did whatever needed to be done, as we always did. But there was a lot more we could do now because more and more anesthesia machines, surgical equipment, endoscopes, all these things developed during practice. And plus, I got to do all these things because there were no other people to do them.
Tell me about your connection to the famous actor Bradley Cooper, who is my heartthrob.
Bradley Cooper's parents were clients of mine. I didn't know who they were when he was a little boy. And I've worked on our animals. I probably met Bradley when he was 10 or so, but I don't remember that. So anyway, about 10 years ago, so I was still practicing. And Bradley's mother had Bradley's dog because Bradley was working on a movie. And she brought the doggy in for Bradley. He was busy. And he had a little tumor. She had a little tumor on her bottom, on her butt. And I removed it. The end result was Donna insisted that I get a headshot of Bradley from his mother. So we have an autographed copy of Bradley Cooper.
So you worked up until what? You were about 77, 78?
Yeah, that sounds about right. Yeah.
Yeah. I think you sold the practice in 2011, but then you remained involved. That was 15 years ago. So you continued working.
In the last 10 years, I've been doing pet home euthanasias for people. Yeah.
We have Donna with us as well, and I would love for Donna to come on and tell us a bit about their commitment to spaying and neutering of the feral cats. So Donna, if you could get on and give us and tell us a little bit about that, that would be great.
So when I married the Donald over here, I didn't know anything about feral cats. I had one cat for 20 years, and Don got to be his dad for the last year of his life. I met Dr. Shields because he removed one of my cat's legs up to the shoulder because he had a myxosarcoma. After the second year of marriage, one of the, we call them cat ladies, but respectfully, because they're amazing. They have little or no money and go out every night and feed 5 or 6 colonies of cats and try to get them all spayed and neutered. And I found out about almost behind, every restaurant and food store and this and that, there's feral cats. So I decided, gee, I married a veterinarian and he can do spays and neuters. So I was going to open up a clinic at my husband's hospital. And we did that once every few months for several years. We had clinics there. And then people were upset. The people really didn't understand, why are we doing free spays and neuters for 50 cats and we have to pay $300? So they were very upset. And then the ladies, who took care of the cats weren't listening to the rules. They were bringing the have a heart traps right into instead of the back door, like we requested, they were bringing them right into So, everybody was getting upset. So Don challenged me to open my own clinic, and everything just fell into place. Like the universe said, this is the time, let's do it. So I called a few of Don's veterinary friends, and as long as they were, doing the surgery for free, we opened up in a little trailer owned by David Wolf of the National Greyhound Rescue. I paid $100 a month, and Dr. Don helped me make the kitchen. It was like a MASH unit. The kitchen was the OR. Then they went on to grooming. Then they went on to the ear tip station. Then they recovered in the back bedroom of this trailer. And we were open for about 4 years.
That's fantastic.
As far as I know, I was told I was the first freestanding feral cat spay neuter clinic in Philly. And then a gal opened up in Willow Grove now. I think she's done over 250,000 cats, maybe more. It's called Forgotten Cats. And what's happening today is, you can get a spay or neuter. There's a lot of places to help people now where you can get a $50 neuter and, $75 spay. And that's with everything.
Yes.
Vaccine, soup to nuts, vaccine, ear tip, and if they have various things wrong with them, a lot of the vets will dock a tail or do entropion eyes, and just because that's their one and only vet clinic their whole life. That's it. Get released out to the colony. And a lot of them are saved. We find friendlies in colonies. So that's what happened. to Dr. Don. He started out doing surgeries, and then 5 years later, he was doing shelter medicine, for free.
Wow. Well,
They
again,
all,
it's
they volunteered. They all volunteered. So
truly a calling, a passion. And you both have it. I can hear in your voice too, Donna, that how committed you are, to your mission. And what made you, decide to continue to do the at-home euthanasias, Dr. Don? What's your motivation there?
That was Donna's idea.
Said he has all this knowledge in his head. Like he still has to practice veterinary medicine. And I happened to see in-home pet euthanasia on Facebook, I believe. And then over the years, hundreds of cats have gone through this household,
Mm-hmm.
I always say for the ones that we kept, all the worst cases we kept. And I'd say, Don, it's time. And then I could always have the cat gently euthanized at home. And I thought this would be a real good idea for other people. And so we started about 12 years ago.
Yeah, it's been 10 years.
And every day he gets called. Our name is out there.
Well, it seems that, I've kind of made this observation that way back in the old days, pre-Dr. Don, the vets did house calls, and then everything moved into clinics and hospitals. And now I feel like I'm seeing a movement back to care within the home. They have mobile clinics. Vets can bring the tools and equipment and medicines that they need for their type of practice with them. And that demand for euthanasia at home is through the roof, because if possible, it's just lovely to be able to have the pet surrounded by their family in the comfort of their own home where it's not stressful, and, move on, transition to the next plane. So I really, really admire, your willingness to continue to do that, because it's very, very much needed.
People are very appreciative in nearly all cases.
Mm-hmm.
What advice would you give to young veterinarians just starting out today?
Veterinarians have to have the fire in the belly, and they have to have hearts of gold, I think.
My cousin is a cardiologist for people.
Mm-hmm.
And he said that he learned the most when he volunteered, I believe, at the free clinic where he went to college. And so when he established his specialty practice, which is covers a 5-state area out of Yankton, South Dakota.
Oh, wow. Yeah.
He built a free clinic, and every intern or resident or, that comes through their hospital needs to work at that free clinic.
Brilliant.
Wow, that's great.
Yeah.
Right.
Wow.
Yeah.
So, if the veterinarians could do something like that to give back their time, I know my personal vet actually has taken on a cause, Miles of Smiles. So she does dental procedures for namely cats, but any pet that is in the shelter system, a rescue that needs a dental procedure before they can be adopted. And so she donates, her time to that.
Wonderful.
Yeah.
That's really wonderful. Wow. Operation Catnip in Florida. She gets all the senior and junior year vet students, and they all learn shelter. They go and they have these huge spay clinics down in Florida. She's great.
I have one more thing that I want to share with our listeners, because Don, when we talked last week, I learned that you're an avid cyclist and that you have participated in my home state of Iowa's.
Oh, right. Yeah.
Yes. It's called RAGBRAI, or Register. It's the Des Moines Register is our newspaper out of our capital. The Register's annual Great Bicycle Ride across Iowa.
Yeah.
And you've done it how many times?
30
times. This is 700 miles. Well, actually, I don't know. How many miles is it across the state?
400 and 500
per
week, 7 days. Yeah.
Yes. So 400 to 500 miles over the course of 7 days in July, when it is hot and humid. And I tried to do it when I was in college, thinking that this is no big deal. I'm invincible. I'm young. I did 0 training. And after the 3rd day, I had to drop out for a variety of reasons. But I have the utmost respect for you. And it seems as though, perhaps there's a correlation between your athletic endeavors as a skier and tennis player and cyclist and your success in your career. You seem to go all out in anything that you strive to do. So kudos.
Thank you. But I'm up next week. I'm going sailing with a couple of my friends.
And see, let's add sailing to the list. So there you go.
Yeah.
So just to wrap it up, thank you both so much for all that you've done, Dr. Don, over 60 years. You've had positive impact in veterinary medicine, but moreover, the lives that you've touched in that time, both human and animal.
It was a privilege to highlight just a part of that legacy in our conversation today. So thank you both for being here.
Thank you very much.
Yes, thank you, Chris, for all you do to educate people and for all you do to help the animals. Bye-bye.
Bye.
Bye.
Hi, Petability fans. This is your host, Kathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.